Good morning, everyone. Welcome back to Saddleback Eye Center. This morning I'm going to go over with you your instructions after your PRK procedure. So all of you received a purple bag this morning. If you want to go ahead, open that bag. You'll have a blue folder that looks like this. Inside that folder you will have the PRK post-op drop instructions. So all the drops that you'll be using for the next 14 days or until that contact lens is removed, it's all going to be listed on this chart. Before I start going over the drops, I do want to remind everyone how important it is that you take the doxycycline pill twice a day for the next 30 days. The doxycycline we typically recommend taking in the morning with breakfast, with an actual meal, and in the evening with dinner, again with an actual meal, not just a little cracker or something. It's very important to have that with food. So as far as the instructions on the drops, yesterday I'm sure you all did the moxifloxacin, which I'll call Moxie, 4 times from when you left our office until when you went to bed, as well as the prednisolone, which I'll call Pred, 4 times from when you left our office and when you went to bed. You probably, if you had time, switched off about every hour, such as doing the Moxie, we'll say at noon, the Pred at 1, the Moxie at 2, so on and so forth, as long as you did each of those 4 times from when you left our office until you went to bed. And this morning we'll start on the chart from day 1 after your PRK procedure with us. So for the next 3 days, days 1 through 3 after the PRK procedure, you will be doing the Moxie 8 times a day, the Pred 4 times a day. So you'll switch off about every hour. If you did the Moxie at 7, you'll do the Moxie again at 8, the Pred at 9. The Moxie at 10, Moxie at 11, Pred at noon. So on and so forth. After that 3rd day, you're going to do the Moxie less. You're actually going to do the Moxie just 4 times a day. So, and you'll keep doing the Pred 4 times a day. So that's days 4 through 6 after the PRK procedure. So since you're alternating evenly, you could do them about every 2 hours, like the Moxie at 7, Pred at 9, Moxie 11, Pred at 1, so on and so forth. After the 6th day, you will do the Moxie just twice a day, but you will keep doing the Pred 4 times a day, and that again would be days 6 until you get the contact lens out, day 14. Again, we don't expect you to memorize this. That is why you have this chart. So you want to make sure as the days go along, you're check marking this off and even putting an alarm in your phone. That way I know you're good about doing these drops. Once you get the contact lens out, the medicated drops will be done unless otherwise instructed. So besides the medicated drops, of course, you'll be doing the Sustain Ultra preservative free for the next year. So these are over the counter. You can buy them at any drugstore, Target, Walmart, CVS, even Amazon. So very easy to buy, easy to use. But they are actually the most important drop that you're going to be using after your PRK procedure. So keep in mind that these drops you will use for a full year, and keep in mind with PRK that the healing is slower than after LASIK. So it's very normal, just like any part of your body. Healing takes up to a full year. And just be really good about using these drops. So what I'm going to state right now is a minimum. If you want to use these twice an hour the whole year, you'd be even better off. So for the first month after PRK, we want to use these twice an hour while awake. Months 2 and 3 after the PRK, we want to use these once an hour while awake. The rest of the year, we want to use these at least 4 to 8 times a day. But like I said, you can never overuse these. The more the better. Keep in mind though, when you want to use them very shortly after a medicated drop, your eyes can actually only absorb 1 drop per eye every 5 minutes. So just don't use these any closer together than 5 minutes, and that would apply for any drop in your eyes. As well as with these drops, I'd like to say that they come in vials like this. So definitely you get a lot of uses out of 1 vial. You can put these in your eyes and you can put the little cap back on. Usually you can get about 4 to 5 uses out of the vials. You definitely want to be using the vials for the first 3 months after the PRK. Months 4 through 12, if you want to switch over to the Sustain Ultra bottle, you can certainly do so. And so that's really all as far as the drops. As far as your restrictions, you will be wearing the goggles we've given you for the next 2 weeks every night while you sleep, or until we take the contacts out. During the day, we want you to wear the clear glasses we provided or sunglasses for the next 14 days or until you get the contact or contact lenses taken out. It's just very important we keep our eyes covered for those 2 weeks. That way we don't touch, rub, or squeeze, because as you know, you have a contact lens in the eye, so we want to make sure we're not accidentally rubbing that lens out. So that's why we want to make sure we keep our eyes covered. Along with that, there will be no swimming for 2 weeks, no sweat dripping in your eyes for 2 weeks. You can certainly work out today, but please use a towel, sweat band, or hat. Keep in mind, it's not bad if you got sweat, dirt, dust, shampoo, any of that in your eyes. What we want to avoid doing though, let's say we got shampoo in our eyes, we want to avoid rubbing our eyes. So instead of rubbing your eyes, just remember whatever got in your eye that's irritating it, just use the lubricating drops to drop, rinse it out, and you will not have any trouble at all. And as far as the other restrictions, no heavy weightlifting for 3 days. Heavy means more than used to customarily lifting, such as over 100 pounds. And of course, for the ladies, no eye makeup for those 2 weeks. And that's really all as far as the restrictions go. As far as showering, it's fine if you showered last night. You probably did neck down. Today you can shower normally. You can shower your face, your hair, all of that. Just keep in mind, of course, when you're shampooing your hair, you want the shampoo to go down your back instead of down your face. And as far as cleaning around the eye area, the best way to really do that is when you're in the shower. Let the shower water hit your forehead. Keep your eyes gently shut. Let that water stream down for 3 to 5 minutes, and that will get away any and all debris that may be bothering you. Of course, besides that, there are 2 rules to keep in mind when gently cleaning around your eye area. Rule 1, which is what we call the 1-inch no touch zone, and that just means 1 inch, 360 degrees around the eye. We want to make sure we don't touch, rub, or squeeze. And that will bring me to rule 2, which is if there's bone, you're safe. And what that means is if I feel there's bone like this, it's okay for me to put pressure, gently pull away from the eye area, use a wet Q-tip, and gently dab. What I want to make sure I'm doing is when I'm dabbing with a wet Q-tip or a makeup remover, for the ladies, I want to make sure I'm going away from my eye area just because I don't want to disturb the contact lens in that eye or in both eyes, depending. So we want to make sure we're following those rules. And another thing, some of you may notice redness in the eye or eyes, and that's very normal. It's purely cosmetic. It will have no impact on the vision. That redness will certainly go away. It can take up to 3 weeks to go away. And that's it as far as the drops, the restrictions, what to expect, and we hope you enjoy your vision. Thank you.